Welcome back to the channel. Today I'm going to talk about a very popular post I have on Substack entitled, "Do not report COVID-19 cases to schools. Do not test yourself or your kids if you're ill." This came out on my Substack. It's incredibly popular, and it's in response to crazy public health measures. So let's get into it. This all got started because Montgomery County, good old MoCo just outside of DC, and actually a county where I once lived in, has re-implemented an N95 mask mandate for kids because of COVID-19 and other respiratory concerns. Well. That's a pretty boneheaded decision by public health. Let's unpack that a little bit. One, what does it mean to have an N95 mask for kids? It actually is a meaningless statement because to claim that a mask has filtration properties of N95, you have to do certain types of accreditation studies which have never been done on children, okay? So you don't know it's an N95 mask for kids. That's number one. Number two, we do know community mask recommendations have no evidence that they improve outcomes during this pandemic, and the randomized evidence from Cochrane shows that they just don't work, as Tom Jefferson himself said. Okay, so the mask recommendation doesn't work. That's in adults. What do we know about in children? In children, we know even little because there are very few randomized studies in children. I don't think there are any randomized studies in children. There are regression discontinuity studies from Spain that show masking doesn't work in kids. And then the other thing we know is that 96% of kids have already had COVID-19. That's per the CDC's own guidance. So you have to be dropped on your head to think that kids should continue to mask in the future. They have no benefit from this strategy. It's never been shown. It clearly has a downside. It impairs communication. It clearly has a downside. People don't want to do it. It's a disutility. That's why most adults are not doing it. And it just takes advantage of the fact of two things. One, that Democrats treat the mask as if Moses himself descended down the mountain and passed him out, and also that it is a political symbol, and it is a symbol that we're doing the right thing, and it's sort of a derangement that exists on the left, and we can take advantage of children. We can actually make children do things that adults don't want to do, which makes zero sense in the pandemic because this virus was always no greater threat to children than influenza. Okay, so it's clearly a boneheaded policy. In response to the policy, I saw Daniela, who is a former employee of the New York City government, say, quote, "Stop reporting your positive COVID cases to your school. I said this in June 2022, and I was dragged for it, but I will keep telling. But if you keep telling your school about your kid getting COVID, shit like this will keep happening. Your kid got a cold, keep them home for a few days, and keep it moving. Keep it moving." That's what she says. It actually got me thinking that if we're going to live in an environment where some public health administrators are irrational, and how are they irrational? They're implementing policy year after year, even though the circumstances on the ground have changed, and even though they've never generated evidence for those policies. And if they're going to continue to practice in a non-evidence public health way, if they're going to continue to recommend things that are more religion than science, if they're continue to infringe upon people's liberty, the liberty to show your face in school, without having any evidence that improves outcomes for anybody based on mostly propaganda and deranged thinking, then we all have to stop participating in this system, okay? We have to engage in nonviolent resistance. What does that mean? That means, and this is in accordance with the guidance of Europe, which I'll come to, if you feel sick this winter, I'm not going to, I will never test myself for COVID-19 again. I've had many colds and flus in my life, and I've only swabbed my nose 3 times, I think, in my whole life, and many colds, hundreds of colds and flus. And actually, the COVID-19 I had, if you didn't tell me it was COVID-19, it was indistinguishable from one of the many other times I've been sick in my life. And no one has ever shown that by testing for COVID-19, we improve any outcomes in any setting for the individual or for the population level. There's never been that randomized evidence. So if you feel sick and you're too sick to go to work, then stay home. That's what I've done for as long as I can remember. If I'm too sick to go to work, I stay home. The moment I start to feel better, I go to work. And that's all we need to do. Now, that's been the way the world has worked for 1,000 years. Now, they want to change it and say, well, you should test and keep testing and stay home and blah, blah, blah. They have to generate evidence that that strategy improves outcomes. And if they don't generate that evidence, then, I don't think it does. In fact, there's no proof it does. And it's very unlikely that it does, actually. These tests are such mediocre quality that it's very likely that you can go even when you're not testing positive and spread it to someone else, and even keep you at home when you could go and not spread it to someone else. The actual tests are measuring usually PCR titers and not measuring infectivity, i.e. the probability that the next person gets it. That's one point. The second point is, where has anyone shown the benefit that for a virus that's continually going to sweep the world for the next 10,000 years, SARS-CoV-2 is now an endemic coronavirus, where is the benefit for having some tiny pockets of affluent nations and some people do a few tests? Does that change the waves across the whole world? It's highly doubtful. It's very implausible. So I think that's an easy one. You feel sick, don't test. Daniela is totally right. Your kids feel sick, I wouldn't even test them. Why would you test a child? What would you do if you had a test result that was positive or negative? They're sick. Stay home if you're sick, and when you feel better, go to school. Certainly don't tell the school. Don't tell the school. Don't tell any public health department or official. Don't give anyone a count of COVID-19. Why? Because if they count the statistic and they don't know what to do with the information, and they can only do harmful things like continue to mask kids with N95s in elementary schools in MoCo, if they're only going to do harmful things, then they shouldn't have that information. They can only use it for illegitimate purposes. You should cut that information from them. I will never tell anyone about any COVID-19 test results I have had in the past or in the future. And I'm not going to test myself anyway. So that's easy. That's what we all should be doing. That's nonviolent resistance for a public health apparatus that is not following evidence-based medicine. Now, look, I would feel different if they ran randomized controlled trials and showed by passing out tests to people and encouraging them to test, you 3 weeks later, 3 months later, 1 year later, you have better health outcomes. If you showed that to me, then I would change my tune. But you never did. And not only that, you didn't even try to do it. You're so stuck in the mechanism that this has got to work that you're not willing to test, does it actually work? And that's the principal hubris of biomedicine. The topic of my first book, Ending Medical Reversal, the topic of my second book, Malignant, that's the hubris of biomedicine. All right, so of course you wouldn't want to test yourself. Now what about paxlovid? Well, maybe I should test myself to get paxlovid. Well, the problem with that is there's probably no paxlovid data that applies to you. The paxlovid data we have is from long ago. It's from unvaccinated people who are at high risk. And it doesn't include people who've gotten vaccines or boosters, and it doesn't include people who've had and recovered from COVID-19. Now, some people say that in the original EPIC-HR, there was a subgroup of people that was seropositive baseline. They don't know that seropositivity is from a prior infection rather than the current infection. They don't know that, okay? That's a big problem with EPIC-HR. That's a technical point. You can ignore that if you don't understand what I'm saying. But I would say that a healthy person should not be taking Paxlovid. There's no evidence. As far as we know, it's a Tamiflu. We have a negative study in vaccinated people. That's called EPIC-SR. It just had results silently dropped on clinicaltrials.gov. It's stone cold negative. We also have the panoramic study running from the UK. Their last update of molnupiravir was null, and the baseline rate in the control group is so low that it's very likely the Paxlovid data will be null as well. We'll find out soon. If it's null, i.e. Paxlovid doesn't work, it is the greatest regulatory boondoggle ever. We've spent $10 billion on it. No, correction. Joe Biden has spent $10 billion on it. I didn't spend that because I'm not an idiot. Without doing the randomized studies first. If he did the randomized studies and it works and then you spend the money, sure, that's how things should work. But not spend the money and then do the randomized studies and then conceal the results of EPIC-SR and highlight the results of EPIC-HR. Ashish Jha, who's the former COVID czar, he keeps tweeting Paxlovid, Paxlovid, Paxlovid. His tag phrase is an ounce of data is worth a pound of opinion. That's what he says on his own Twitter bio, but he doesn't adhere to that. He does not adhere to that because here he's giving you a pound and a half of bullshit opinion. That's what he's doing. His opinion is bullshit on this topic. So until somebody proves to me that Paxlovid works in 2023, by the way, for current prevailing strains in people who've mostly had and recovered from COVID-19, I don't think there's any role for it going forward. All right. Now, if anyone is sick, should you let the school know? I would say that at this point, they misuse information so great, you should just call an absence for a different reason. You shouldn't even let them know if somebody's sick or not. That's up to you. You don't have to tell the school why the kid's not in school. Stop reporting illnesses. Encourage colleagues to stop reporting. Decline any COVID-19 vaccination, any further doses until RCTs show benefit, randomized controlled trials for your age and prior COVID history. I think that's a very simple one. I'm not going to get any more boosters until they prove to me that for somebody my age and of my health, who's already had and recovered from COVID-19 and already gotten 3 of their shots, that there's an additional benefit for me to get the new one. And they haven't done that. Worse, they're not even making Pfizer try. They're just giving Albert Bourla money, without making him prove that his products work. And that is a great sin. That is the principal sin of drug regulation. That's the reason why Marion Gruber and Phil Krause, the deputy and director of vaccine drug products, resigned. Okay, because there was too much pressure to approve boosters without evidence. Now, what about mandates in your hospital? I've gotten a lot of people email me about that. I don't know what to do about that. Do your best to decline, I think, is the best thing to do. I mean, I think it makes no sense. Now let's talk about other nations. The United Kingdom, the the NICE and the NHS, the National Health System, they are not offering flu or COVID vaccines to anyone under 65 unless they have some other reason. They're not offering it to healthy people under the age of 65. That's pretty sensible. Australia is not offering COVID-19 boosters to anyone under the age of 65. Again, sensible. European nations do not advise you to test for COVID-19. Sensible. European nations do not mask children anymore. Sensible. This is a sensible global strategy. America is incredibly polarized, and on the left, they have lost their minds with COVID-19. Their entire reaction to COVID-19 on the left was because Donald Trump didn't seem to take it seriously. It's fine to have a reaction to Donald Trump, but it's not fine when you let it rot your whole brain out. We are now in 2023. If you're sick, stay home. If you're healthy, go to work. Nobody should be tested for COVID-19 until the test manufacturers prove that the routine testing actually improves health outcomes. They've never done so. They have an obligation to run those randomized studies. They haven't. No one should take paxlovid until the manufacturer shows that it has a benefit in somebody like you with as many times as you've had COVID and as many times as you've had vaccine. They haven't done those randomized studies. No one should take a booster until somebody shows it has benefit in somebody like you. And other nations are not having the same policies as the U.S. These policies will clearly enrich the companies, but it's unclear that it has a benefit to the American people. Medicine and science is something that's objective, and there's an easy way to settle these disputes. If you believe that swabbing yourself daily before you meet a relative is going to help that relative stay healthy longer, you can test that hypothesis. You can do a cluster randomized trial of people about to go to meet relatives, or actually an individual randomized control trial of people about to meet relatives, randomize them to swab and stay home if ill or not, or just go if they feel fine, and measure how those relatives look 2 months later. And I suspect you'll find it's a total wash. I mean, because there'll be some people the test fails on and they spread it anyway. There'll be some people who get false positive, they stay home, they have a reduction in quality of life because you don't get to see grandma, and you wouldn't have spread it to her anyway. And also, their grandma still is at risk of getting COVID from all the other people in her life who aren't following this ridiculous protocol. So grandma may get the same amount of COVID no matter what you do, in which case you're just preventing your interactions with grandma for some idea that's stuck in your head, some mechanistic seduction, without any empirical data that it actually improves grandma's well-being. And that's where we are today. This is literally the plot point of ending medical reversal. This is literally what my research career has been, which is that simply hypothesizing a mechanism by which something will help is not the same thing as proving that it does help. That's a big distinction. So putting this all together, what do we find? MoCo is implementing an N95 mask mandate in elementary school children. I would say that even somebody who supports that strategy in 2020, by 2023 has to think it's pretty ridiculous. It's certainly unethical. It's unethical to continue to subject the most vulnerable people in America, children, to unproven restrictions that restrict their freedom to show their face and their freedom to interact with their colleagues without any evidence that you improve any outcome for the children or anyone else at any period in time. Okay, there's no evidence to justify this. They're doing this because they're counting cases and they're getting scared. So if somebody is irrationally responding to information and they can only use it for bad, that information they're given, to be honest, you have a moral duty to deprive them of that information. So I think you should cut them off, not test or not send that information to them. Whether or not testing helps you in your personal life, I don't even understand why it would help you. Somebody's like, oh, well, it would be good to know if I had COVID. Really, why? If I'm feeling sick, I want to take it easy, whether or not it's SARS-CoV-2 or rhinovirus or influenza B or whatever the hell it is, who cares? You're feeling sick, and the moment you start to feel better, you want to get back out there. Has anyone shown that by continually testing past the point you feel better, you actually lower transmission to a third party? That's what you hypothesize, but actually, you've never shown that, okay? It's actually never been demonstrated. So when you put all this together, you have a cocoon of bioplausible but non-empirically validated ideas that are being promulgated as if they're gospel by a bunch of people who are not thinking clearly because they are intensely political and they have proven that they're panicking. And the biggest reason they're panicking now is long COVID, which is a boogie monster that they have largely created based on very low credibility studies, and better credibility studies show that long COVID is essentially not really a thing in children, as one would expect, because it's never been a thing, long respiratory virus in children when they get a mild case and recover, and you have yet to demonstrate anything other than that for this particular respiratory virus. So, in my estimation, Daniela is correct. The only logical course left is to not participate in this public health system. The real deep solutions will be deep reform of CDC and NIH and FDA, which means firing a lot of people. Anyone at CDC who ever said it was okay to mask a 2-year-old should be fired, okay? They should be fired for gross incompetence. And anybody at FDA who thinks it's okay to approve booster after booster after booster should be fired as well. It's very interesting that they're moving forward with this booster when Peter Marks himself wrote an article in JAMA a few months ago, and he's the FDA he's the head of this branch now because the other people resigned. He said that he would demand clinical trial data measuring clinical endpoints, and he has backed away from that. I don't think these decisions are being made by drug regulators. I think they're being made at the White House. I think that's what you see. I think it's irresponsible for the CDC director to say when COVID-19 vaccines will be made available when we don't even have any evidence. And those decisions haven't yet been made by FDA. So we have a very broken system. All of the problems in medicine, and the biggest core problem in medicine is approving and doing things that you don't really know help, that you think might help at great cost and great expense and great burden. That's the core failing of American medicine, at least. Maybe the core failing of global medicine is not having access to things. But American medicine, it's doing things too much without any proof. We're living in that. We're just drowning in that when it comes to COVID-19 policy. It's so irrational. The gap between where, a handful of zealots on the internet are and the average American is huge. There's no way it makes sense when you walk around airports or malls or bars, anywhere, even in San Francisco, that you would put a child in an N95 mask in MoCo. It makes no sense at all. It's absolutely harmful, absolutely problematic. It's deranged. I think public health is just done. I mean, I just see I used to think there was a path that public health could recover some credibility. I think it's just so broken. And, that's a product of many things. That's beyond the scope of this video that hopefully I'll talk about in the future. So, if you feel ill, should you test? Again, no one has proven to me that has any value for myself or anyone else. Should I take paxlovid? Again, no one has proven to me that a person who's had 3 doses and COVID will benefit from paxlovid in the future, so I'm not going to do that. That would be crazy. I don't take medicines without proof that they help me. Certainly not medicines that contain ritonavir, contain protease inhibitors. Should I report these cases to any public health authority? I don't know. They've never shown me that they can use that information for good. They've only shown me that they can do stupid things with that information, so I don't feel compelled to do so. And should I get more boosters based on no evidence? No, I don't think so. I don't think most people want to, and I think that's why booster uptake for the last one was like 14%. For this one, it'll be like 7% or less. Then they'll do a study of the 7% of people who got it do differently than the people who didn't. Well, of course, but they're a very select group of people, don't you know? We proved that in the New England Journal. So, if you like this video, you know what to do. Like, subscribe, comment, leave a message below. I would say nonviolent resistance is the only way now to deal with public health. They have overstepped their authority. All right, I'll be back more videos. Until next time.